Evangelical Hospital has been able to combat human trafficking by knowing what to look for.
So statistics show that 88% or more of trafficked victims at some point in their victimization access healthcare. So those of us working in healthcare, we are in a unique position to intervene because they are coming to us. So that's why it's so important for us to know what to look for and have a plan set in place how to help them.
And so,
One of the reasons Evangelical has focused on human trafficking is the amount that runs through our area.
And this Route 15, from New York all the way to Maryland, is one of the most heavily trafficked, human trafficked corridors in the country. And when I began to serve on the transitions board, I had my eyes open to this. I had no idea the level of human trafficking that was taking place. And I began to, ask questions about, what are we doing as an organization? Does my workforce understand this? Does the people who cross path with patients understand it? Rachel has been our SANE nurse, our sexual assault nurse examiner nurse for 12, 13 years. And, I pulled her in and she was a wealth of information. And so I decided that it was important as a workforce. Our workforce began to ask us this past year for their mandatory trainings that we do just as part of being an evangelical employee to be more around social issues. So we decided we'd take on the opioid issues locally in educating, but we'd also take on human trafficking.
Usually victims, when they do present to any entity that's a resource that would be able to provide service to them, they're not going to come in saying, I'm a victim of trafficking. What is available? What can you do to help me? They're going to come in with totally different issues or wanting different information. There's a process that we do for screening when individuals call our hotline that will determine is this an individual that's coming because they have domestic violence issues? Is this an individual coming to us because they have sexual assault issues? Or is this someone that's coming to us because we are the Comprehensive Crime Victim Center for Union, Snyder, and Northumberland County. So we're able to help with all victims of all serious crimes. And when these individuals come to us, they usually come to us under another concern.
Some of the indicators, someone who's being trafficked, if they present to an acute care facility, say ER, urgent care, even doctor's offices, OB, a lot of times their trafficker will be with them, and a trafficker is going to be very reluctant to leave the room. They may answer questions for them. They may try to interpret for them if their primary language is not English. Signs of abuse, a lot of traffic victims have tattoos that are very specific to trafficking. One being on the inner lip. They'll have a name on the inner lip. Yeah, so, along with other signs and symptoms of physical abuse, which isn't specific only to trafficking, but there are things to look for as far as specific bruising patterns, petechiae around the eyes. So I teach people about that.
With Evangelical's ability to examine 24 hours a day, they have been able to combat trafficking.
What we didn't have until that was established by Evangelical Hospital, we didn't have a 24-hour emergency response to sexual assault of children under the age of 14. And since the average age of entry into human trafficking is between 12 and 13 years old, tends to be younger for boys than for girls. Having somebody that can collect the evidence is very critical, and now Evan's fully equipped to collect the evidence that's needed for prosecution, because that's what we need, is to build cases of prosecution under Act 105. So yeah.